Barium sulfate. That is a thick white fluid which can be taken by patient if the digestive tract should be examined by an X-ray. This barium sulfate is opaque to the X-rays, and then on the X-ray film ulcers or growths should be visible. There's barium swollen for the gullet, or barium meal for the stomach and small intestine, and also barium enema for the colon. That is according to Keith Hodgkin's Family Medical Advisor book on the page 88, but this is now medical advice. If you click this video away at one point, then please tell me what the reason was so that I can improve. Otherwise, hi and welcome. I'm trying to learn medicine today, barium sulfate, and after we've done what we're going to do, squat training. And if you participate in the squat training, then it's at your own risk. Barium sulfate. And we're talking about internal anatomy and also about internal anatomy and also cancer. And this is non-medical advice, we're just reading it and trying to understand it. Barium sulfate, a thick white fluid that is passed into the digestive tract when it needs to be X-rayed. Barium sulfate is opaque to X-rays, and so any abnormalities of tract, such as an ulcer or growth, are shown on the X-ray film. Barium sulfate, it is a thick white fluid which can be passed into the digestive tract if that digestive tract should be X-rayed, and opaque, I don't know what color opaque is, but some type of color. It's been opaque to X-rays, and then on the X-ray film these abnormalities like an ulcer or a growth somewhere are hopefully visible. For a barium swallow, to examine the gullet, wherever it is, or a barium meal, to investigate the stomach and or upper intestine, the patient drinks the fluid. In a barium enema, to examine the rectum or lower intestine, it is pumped up the rectum. Okay, we're having barium swallow for the gullet, wherever the gullet is, barium swallowed and barium meal for the stomach and so the small intestine, the upper. And then we're having also barium enema. That seems to be the official name. I don't know what enema means, but I'm going to take it. Enema for the colon or the lower intestine. Barium sulfate, do I know it all? Barium sulfate, it is a thick white fluid which can be taken by the person if the gastrointestinal tract has to be examined. The digestive tract. Okay, gastrointestinal tract, digestive tract, should be examined with an X-ray. It is an opaque on the X-ray. It is opaque to the X-ray. Does it mean it is then opaque on the film? It is opaque to the X-ray, and when on the X-ray film there should be ulcers or growths visible. There is barium meal for the stomach and small intestine, and barium swallow for gullet. Barium meal for the stomach and the small intestine, and barium gullet, no, barium swallow. Barium swallow for the gullet, and then there's barium enema for the colon. Something else? Just colon. I'm going to start the camera and then try to save it. Barium sulfate. That is a thick white fluid which can be taken by patient if the digestive tract should be examined by an X-ray. This barium sulfate is opaque to the X-rays, and then on the X-ray film ulcers or growths should be visible. There's barium swollen for the gullet, or barium meal for the stomach and small intestine, and also barium enema for the colon. That is according to Keith Hodgkin's Family Medical Advisor book on the page 88, but this is now medical advice. And with that, we're already through with the medical part. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the squat training, then it's at your own risk. We're bringing one foot. Pull it up. And the other one. And take the leg to the ankle, straight back, knee onto the ground. Other one. And one leg to the side. The toes are pointing in front, stretching the inner side of the leg. And to the other side. And go from side to side. And now, the legs wide apart, and we're doing 12 squats. The first one, and the second one. Let's go on with number 3, and 4, number 5, and the next one's already the fulfillment of the half. So 7, and 8. Number 9, 3/3, and 10. Last 2, 11. Next exercise, the 6-pack squat squeeze. Down into quarter squat and press against the top of the leg on one side only. And on the other side. Down into half squat and press against the middle of the leg. And on the other side. On into 3/4 squat, press close to the knee. And on the other side. And away. Now, the fastest giraffe of a water pond exercise. Down into 3/4 squat, press against the knee. Go towards it. And again, press. Go towards it. Again. And again. And again. And again. Last 2. Last one. And up again. And the last exercise, the propeller. Down into full squat, arms to the sides, over to one side, press against the leg, look up to the other end. Little bend in the elbow. Middle, over, press. And up. And now, one heel onto the ground, pull the toes in. Foot to the left, pull the toes in. To the right, pull the toes in. Middle, move the leg from left to right. Upper heel onto the ground, pull the toes in. To the right of the toes, pull in. Left. Middle, and move from left to right. And now one leg up. The other one. One again, the ankle. Straight back, knee down. Up one again. Legs wide apart, breathe in and down. And breathe again out. In and out. And breathe in, cross the legs. And breathe again out. That was the squat training. I thank you very much, and until next time.